The World Health Organization's primary mission is to promote health for all through global collaboration and coordination among nations. In the wake of the COVID-19 devastation of the global human space and under the guise of ensuring compliance to medical interventions, some stakeholders say the WHO now seems to be in pursuit of greater power over the sovereignty of nations in the application of healthcare measures. Well, I'm now being joined here by Dr. Obi Ideh, an executive member of the Foundation for Africa's Cultural Heritage, as well as co-convener of the Coalition Against WHO International Health Regulations. It's great to have you here.
Thank you so much.
Now, quite a controversial conversation. Now, where do we draw the line between adhering to the regulations that are created by the World Health Organization, and a nation's sovereign right to choose what they feel is right for the health of their citizens?
Well, I think it's important for us to be able to understand, first of all, that the international health regulations were actually started off with very good intentions. And for the most part, till 2005, everything was kosher. Now, the amendments process has always been flawed. And because it isn't something that we're taught about in medical school, until COVID and the really disastrous ways that the WHO acted in the time of the COVID pandemic, nobody really took great notice of what the bureaucracy involved in the WHO and how it ran its administrations. But when we who followed the problems with the WHO response to the COVID-19 pandemic realized that the international health regulations amendments run as an opt-out system, and the amendments that were first adopted last year, which have no health benefits to Nigeria, it started to become a big issue. And so when there is a truly health issue on ground, one wants to know that the organization that one has decided to co-opt oneself into is actually working for one's benefit. So the adopted amendments for last year are saying that Nigeria will have less time to analyze future amendments. How does that help Nigerian citizens to have less time to be able to react to the amendments that the WHO has put together?
So now, besides the time factor, what are you advocating for?
First of all, we need our president to write to WHO and say, no, we do not want to be constrained in time to be able to analyze what is going on with the WHO. That's the first thing. The reality is that whatever is going to be presented in May of 2024, we don't know what will be in it. The people who are working on the amendments have decided that they're going to keep working up until May. Now, this is in flagrant disobedience to Article 55, which says that member states need to get whatever amendments are being adopted 4 months before the World Health Assembly. There is a growing call to exit the WHO because its funding is not by member states, it's by organizations with their own priorities, and those priorities showed during COVID. And so we do not feel that our best interests are being served by the WHO.
Now, what are some of the risks of excluding ourselves from such a huge organization? Because it sounds like a daunting proposition.
Well, it is a movement that is not fringe. There are many, many countries that are coming to understand the role that the WHO played in COVID-19 that were egregious to its citizens and are therefore reappraising their membership. And this actually even started right during the COVID pandemic and even before. So I believe that when we open ourselves to the understanding that while we have always seen the WHO as a benevolent organization, that it is to our benefit to be part of, once we are able to see a track record that shows otherwise, we should have the fortitude to look at what is in front of us and say, well, this doesn't work for us, this isn't how it should be, and exit to better pastures, really.
Now, one of the concerns that immediately comes to mind is the fact that, in this part of the world, we already have a difficult trust relationship with the health sector, especially where immunizations, vaccinations, things of that nature are concerned. Wouldn't this move further shake up people's trust in the system and in especially the compulsory element of vaccines and immunization rollouts?
We unfortunately have medical science as we know it has a history that hasn't truly been honest. And there are many gaps in our education that have facilitated the type of clinical medicine that has come to the fore. And it is only more recently that we are having dialogue and research that is focused on health rather than disease. Now, when you have a healthcare system that's focused on disease, then you are focused on diagnostics, pharmaceuticals. That is the direction in which you're taking the population, as opposed to what is healthcare? How is nutrition? What are the actual, the other ways in which wellness can be facilitated so that you have more of the population remaining well, rather than considering healthcare as being reposited in a hospital. It's sick people that are in the hospital. Wellness, health is in the community. How do you help the community actually remain well? How much preventative community health is our healthcare actually geared towards? Those are the issues that one realizes that multinational and really our own health organization has our own national health structure has not really helped our citizens to create the health and to preserve the health that they have. For where the WHO is concerned, we have until December 1st for President Tinubu to write to the WHO and say, we reject the amendments of May 2022. If he doesn't write, we are automatically moved into the countries that once there's a new amendment, we will only have 1 year in which to reject them. 10 months, and then after a year, they come into force. For many people, what I'm saying seems arbitrary, but let's cast our mind back to COVID. Okay? What COVID was a public health emergency of international concern. Once that is pronounced by the WHO has powers that it is seeking to be able to do different things that we will not have control of. However, whatever those changes are, it is important for us to push back on those powers and start, first of all, by saying we would like to keep the time in which we have to analyze amendments to what they were before. That is the letter that the WHO needs to get before December 1st this year.
Well, this is a very important conversation, and I thank you so much for your time. Our time is far spent, but I look forward to following more of your work on this. Dr. Obi Ideh, Foundation for Africa's Cultural Heritage and co-convener of the Coalition Against the WHO International Health Regulations. Thank you so much for your time.
Thank you so much for having me.